Hi guys, so if you saw us earlier, we were outside of this mobile mammogram unit that Metrohealth is so wonderful to take throughout the community to make sure that people are staying on top of getting those mammograms. I have Kelly Vogel with me this morning now. We're inside. You're the radiology manager.
Yes.
And I'm happy to be here with you because I think this is such a wonderful tool that Metrohealth provides to really help get out there in the community.
Well, thanks for coming. Yeah, we just want to stress the idea of getting your screening mammogram annually after the age of 40. Those are the guidelines for Metrohealth, and we follow the Cancer Society guidelines. So welcome to the mobile unit.
This is it. Now you go all over to different locations in Northeast Ohio.
We go to all kinds of locations within Metrohealth, outside of Metrohealth, and currently 7 different locations with Discount Drug Mart.
And this is something where if people are saying, oh, well, it's not in the hospital, so I might not be getting the same standard of care that I would get if I was in the hospital. That's not the case.
It's not the case. Yep, it's the same standard of care. It's 3D imaging or breast tomosynthesis. So, yeah, it's the same technology.
So take me through the process. When I come in, I schedule an appointment. We need to schedule an appointment.
Yes, you schedule an appointment, and we have a process for that, and you can go on our website and check that out. All of the Discount Drug Mart schedules are there for you to look at and decide if you want to visit. But you come in, you check in with Carly.
Hi, Carly.
Yep. So she'll check you in, get your information, and then after that, we'll go over to the dressing rooms.
Let's walk back here. So the dressing rooms are behind us here. And I know it's...
Oh, how about the other one?
Now I'm going to stop you from being able to see because we're... This one?
Yeah.
Okay. You know, you're not really going to be able to see this from... Oh, there we go.
There you go.
There's 2 doors. Perfect.
So you come in one way and you go directly into the exam room, so your privacy is respected.
That is wonderful then, too. So we come in... And I'm used to seeing that machine, that's for sure.
Yes.
So there's the unit right there.
Yep. And so the technologist will greet you in this room. She'll verify your identity and perform your mammogram, and all within the privacy of this room.
And I know it is so important. And one of the big things that even as I continue to talk to women about this, I didn't understand how much people were afraid of getting one done and thinking it's really going to hurt.
Easy.
And I know that maybe depending on the time of the month that you're in, it might be a little bit more tender and hurt some, but overall, women have gone through so much harder things in life than this.
It can be a little uncomfortable, but I just want to acknowledge that our team will work with you and get your mammogram done as pain-free as possible. There is no pain. It's just a little discomfort. There is still some compression, but it's very light. And like I said, the team will work with the patient to make sure that it's a comfortable exam.
And it's so important to do that. I know, as I've told a lot of you, I've also, well, now I don't do anything because of my scenario, but I was having to do an MRI opposite of it. And having both is so important. And sometimes people think, oh, well, then if an MRI shows so much, why do we even get a mammogram? But mammograms show certain things like calcifications that even if you have dense tissue, will still pick up. And
it's a very easy exam. It's accessible. So MRI is a little bit more... It takes an hour, 45 minutes to an hour to have an MRI exam. This takes 10 minutes or less. So it's a very easy exam to screen for breast cancer. And it catches those very early breast cancers.
Which is the key to all of this. I mean, no one wants to have to go through... When 1 in 8 are going to get it at some point in their lifetime, it's a matter of just, let's catch this early if it's going to happen to us.
And treat it.
Yep. And sometimes then treating it when you catch it so early does not involve chemo. Sometimes it doesn't involve radiation. But if it does, they have Metrohealth to guide them through that process every step of the way. We just heard from Dr. Joseph earlier how important it is you're expanding now your services in the breast health center there.
We have a new breast center opening in April 2026.
Which is really exciting. So
state of the art,
You will have access to that, but also we've had the website up that they can go to sign up, and make sure you do that.
Yes.
Get those mammograms, ladies. Thank you so much for being here today. Thank you for listening to this.